This is medication administration 3. I will be doing 3 IM injections, one into the deltoid, one into the vastus lateralis, and one into the ventrogluteal muscle. The last injection will be a subcutaneous injection in the abdomen. All medications have been checked and verified with the MAR, checking for right patient, right time, right dose, right route. Hi, my name's Dana. I'm your nurse for today. Can you start with verifying your name and your birthday?
My name is Christian Bradley. I was born February 18th, 2007.
Good. So, do you have any drug allergies?
No.
All right, let me perform hand hygiene. So I have a couple of injections today. Typically, you wouldn't get all of them at the same time, but for time's sake, we'll be, and training purposes, we'll be injecting 4 injections today. So I'm going to don gloves here. I'm going to check my medications. All injections are going to be checked against the MAR for right time, right dose, right patient, right drug, and right route. Okay, everything is verified. All right, let's start with your deltoid. I'm going to move your sleeve up just a bit to expose the area. All right. I'm going to inspect for any skin lesions, excessive hair, or cleanliness. Okay. I'm going to find my landmarks. So I'm going to, this is your acromial process. I'm going to do 2 fingers down for you and in the midline here. Okay, good. All right, I'm going to take my antimicrobial wipe and I'm going to wipe the area starting in the middle and rotating outwardly about 2 inches. Okay, I'm going to throw that away. I'm going to wait for that to dry. I'm going to uncap my needle with the non-dominant hand. And using a Z-track, I'm going to displace the skin about 1 inch to 1.5 inches. I'm going to, with a darting motion, inject, and you may feel a pinch, okay? All right, I'm going to inject at a 90-degree angle, swiftly. I'm going to take my non-dominant hand, stabilize the needle, and I'm going to slowly inject into the skin. About a milliliter every 10 seconds. Okay, I'm going to pull out at the same angle as I injected. I'm going to throw that in my sharps container with the lid on. I'm going to remove my hand here. Get a cotton ball, apply slight, gentle pressure, making sure not to massage the area. How does that feel?
Good.
All right. I'm going to put a Band-Aid on here for you. I'm going to put your clothing back down. Good, you did good. All right, now I need you to lie down for me. Okay. So I'm going to expose your thigh. This is an IM injection to your vastus lateralis. I'm going to inspect the skin for cleanliness, lesions, or any excessive skin. All right, I'm going to locate my landmarks. I'm going to do a palm above your knee and a palm above your below your trochanter. I'm going to do a third waist down and to the side to locate that muscle. All right, good. Now try to relax here, okay? I don't want you tensing up on me. I'm going to take an antimicrobial wipe and wipe the site of injection, starting in the middle and working my way outward about 2 inches. I'm going to discard, allow that to dry. I'm going to uncap my syringe with my non-dominant hand. I'm going to displace the skin using a Z-track. And with a darting motion, I'm going to inject. I'm going to inject at a 90-degree angle swiftly. And now that that's in, I'm going to take my fingers to stabilize the syringe. I'm going to inject slowly, about 1 ml per 10 seconds. And then I'm going to remove at the same angle that I injected. I'm going to remove my hand, cap the needle here, put that in a sharps container. All right, I'm going to apply gauze and slight pressure. All right. Now with this sort of injection, you may feel some pain. It's going to be important that you move your leg around a bit, okay? All right, you did great. All right. Now I want you to turn on your side. We're going to do your ventrogluteal muscle. All right, a little bit more for me, honey. Okay. All right, I'm going to pull your shirt up here. All right, and we won't expose your backside, but for training purposes, we've got a hip here. I'm going to place my non-dominant hand over the greater trochanter, the heel of my hand. I'm going to press on the abdomen just a bit to locate that iliac spine with my forefinger. Then I'm going to spread my fingers. My injection site is going to be right in the middle of the first and third finger. There we go. All right. I found my injection site. I'm going to inspect it here. Wipe with an antimicrobial wipe, starting in the middle and working my way outward about 2 inches. I'm going to discard that. I'm going to take my syringe and cap with my non-dominant hand. With my non-dominant hand, I'm going to place it here to the side of the injection site using a Z-track. I'm going to displace the skin about 1/2 to 1 inch. With a darting motion, I'm going to insert at a 90-degree angle. I'm going to take my finger and stabilize that syringe once it's in. I'm going to inject slowly, about 1 ml per 10 seconds. Good. I'm going to withdraw the syringe at the same angle at which I injected. Cap that syringe, place it in a sharps, remove my hand, and then I'm going to apply a cotton ball here in slight pressure. I'm not going to massage that area. All right, again, this is an area, Christian, that is, it may be slightly painful, so it's going to be helpful that you exercise a range of motion, good range of motion, maybe get up and walk around a little bit, okay? All right, perfect. Now, let me have you roll back over on your back. This is our last injection. This is a subcutaneous injection. And this time I'm going to pull your shirt up here, expose my site of injection. I'm going to choose a site that is 1 inch away from the umbilicus. Inspect the skin for any lesions, excessive hair, and cleanliness. I'm going to wipe with an antimicrobial wipe, starting at the center, working my way out about 2 inches. I'm going to discard that. This time I'm going to take my syringe, I'm going to pinch the skin a bit. I'm going to inject as I would a dart at a 90-degree angle. Alright, once it's injected, I'm going to release that skin. I'm going to stabilize my syringe. I'm going to inject slowly. Then I'm going to remove at the same angle. Cap my syringe, throw that in a sharps container. Take a cotton ball here, apply slight pressure. There's no bleeding here. All right, you did wonderful, Christian. Let me put your shirt down. I'm going to document the medications that I've given, the site and the time, etc. Oh, and before I actually document anything, I'm going to remove my gloves, perform hand hygiene, and then document.